Welcome back. We first discussed the oxygen shortage crisis that we are looking at in our country. We now move on to the other very important part, which is testing. And because oxygen as a life-saving has become such an important conversation point, in the last few days, many have actually not looked at what's going on the testing front. But it's equally challenging and it's equally dangerous if we are not able to ramp up our testing to the levels we require right now. And let me just explain it to you in very simple terms. If your testing gets delayed, if you get a slot for testing late, if you can't get a home sample and you have to go out, that means you expose others, then you get your test done, wait for 2 days, 3 days, even 1 week in certain cases that have been reported in many parts of our country, then that's just adding to the whole problem. If the hospitals insist as a rule that they will not admit you, even in many cases if you're showing symptoms because you don't have a COVID test report, then what are you going to do? You wait for a week to get your results, you reach the hospital, you're already in a serious condition, and then adds to the burden, not just for your family, but also to the entire battle against COVID right now. So what can we do? It's obviously not the fault of the testing labs because they are overwhelmed. They are currently dealing with their own set of challenges that includes the fact that they are overburdened and overwhelmed with samples. They're running out of the material that is used to carry out the test. And I'm not just talking about the testing kits, but what is required to actually test the sample. They're also facing shortage of manpower on their own end because many of their own staff have tested positive for COVID. Curbs in states are only going to make it more difficult. So how do we solve this problem? We can't be adding to the problem just at the first stage, which is testing. Take a look at the data that we actually got from Delhi. There has been a 70% decrease in testing in Delhi. On an average, they were doing 95,400 tests in the April week 13 to 19. This has come down to 79,000 tests in the week April 19 to 25. I was just looking at similar data that has come from Uttar Pradesh, where the cases have staggeringly gone up, but the testing has increased by just 0.1%. So the testing has stagnated even when the cases have gone up from 26,500 to 33,500. So obviously states are struggling to ramp up the capacity. Mumbai has seen lower testing in the last few days than what we saw in the 2 weeks before that. What's going on? Let's ask our experts, and what can be done rather is the bigger question. Dr. Velumani, MD for Thyrocare, joins us. Dr. Vinay Goyal, Managing Director for Life Care Diagnostic and Research Center, and Dr. Sanjay Arora, Founder and MD of Suburban Diagnostics, joins us as well. Let me first go across to Dr. Sanjay Arora. Dr. Arora, what is the solution? Where are the pain points, and what can quickly be done to then resolve this?
So, Tanvi, I think the biggest challenge that labs face today is to be able to predict the volumes. As you very correctly said in your introduction, that predicting the volumes becomes the biggest challenge for us. And once we know what the volumes to be expected, then we are able to ramp up our capacity. As we speak, at least in our lab, we were testing close to 6,000 samples every day, and that was our capacity of about 7,000. But as you said, the labs just got overwhelmed, and we started getting 8,000, 9,000 testing requests every day. So what we have done is we have expanded our current capacity to about 14,000 tests a day. In fact, our corporate office, which is extended, has become part of a molecular lab now. We have just extended, we've stopped our corporate office and we have converted that into a molecular testing facility. And that's what we have done, is to try and increase our capabilities of testing more samples within a given 24-hour period. And also we've tried to increase the access points. So, so that we have about 20 locations across the state where people can come exclusively to give their samples, as well as ramping up our capacity of home collection. So we have about 1,000 home visits that we do on a daily basis in trying to help people who are not able to move out of their house so that we can collect samples from their houses. So trying to increase the access points for test sample collection as well as increasing our capacity within the lab to be able to meet the increase in demand.
Okay, that should be one thing that should be looked at definitely. Dr. Vinay Goyal, would you like to add to this? The ever increasing demand across the state. How do we ramp up testing now? In the first wave, we spoke so much about importing these kits from around the world, but it's not just about the testing kits anymore.
You're right, Tanvi. So I think in the last couple of weeks or a little more than that, there have been a lot of challenges on the ground. While ramping up the capacity is always the option, and we too on the similar grounds have doubled up our capacity and increased the home collection as well as various kind of touch points. But the reality is that there is both critical and non-critical requirement of the tests. So there is a basket or it's a kind of a mix of both. There are people who just want elective testing for travel or for whatever reason, like screening of their society, etc., etc. And there are people who really need the test for admission to the hospital or for other symptoms. So I personally felt that we do categorize people when we are overwhelmed with the number of tests. We say that, okay, let's categorize first, give the priority to people who need the test for various clinical reasons. And we try to finish that first, though our turnaround time is always 24 hours. But I think some people need faster than that. So we try to give them between 8 to 12 hours or 18 hours, whatever possible. So we at our end have tried to do that much. But the actual another challenge is that the supply chain of the materials required for doing this testing itself is become a bottleneck, because for whatever reason, I think the government should look into why suddenly the VTMs have become 3 times the price, or they've certainly become much less available. So if you don't have the VTMs or you don't have the basic supplies, how are you going to collect the samples? And if that is going to become 3 or 4 times the normal price, how are you going to survive it's getting crazy. And similarly, the human resources, of course, we have abundant backup. But generally, as you see with the lockdown and everything, travel becomes an issue. And so does their rate of getting sick sometimes, or sick leaves, etc. So that becomes a second challenge too. But that all we can mitigate. But I think the supply of the basic material should be abundantly available at a price which was defined by the government, and it should not be overshooting the price. Similarly, for the PPE kits, etc., we should be looking at that. I think other than increasing the capacity across, we have to categorize and give priority to people who really need your services. LifeCare has believed in that throughout, and we have given the best of our services throughout by increasing the capacity continuously. I think that's the way to go.
Okay. Mr. Velumani, you and I have spoken about this earlier as well. Now, in terms of what can be done, prioritizing obviously for those who need it for clinical purposes is one. But for us to track and stop the spread of COVID as well, we need higher testing. We've not just seen stagnant testing. In many states, we've seen the testing numbers go down. What else could be the reason there? Is it the backlog? Is it that labs themselves are struggling with manpower? What would you say?
Actually, the uniformity of demand supply is not in the country. In city Mumbai and in city Delhi, suddenly there was a spark. As Dr. Arora said, we are suffering with problem of inconsistent demand, which means we were needing 15,000 a day in September. It fell down to 2,000 a day. So all infrastructure we felt is waste. From 2,000 a day today, we need 25,000 a day. There is no infrastructure that easily scalable. So inconsistency of demand supply is going to continuously pain the laboratories. And the second, as Dr. Arora said, the challenge is the human resources to reach home. I must add the third one. Maharashtra has reduced the pricing just recently before the onset of the second wave. You know, the collection at home is done by people who will do only for an extra 100 rupees. If that is deprived, all manpower have got demoralized. And today reaching to home has become very difficult. So we have kept open our laboratory for anybody to walk in anytime 24/7 in Delhi, in Mumbai and in Bangalore, so that there is no problem of home collection stopping them. But I agree, a patient traveling to a laboratory is a risk of spreading that continues to remain a problem from the beginning.
Tanvi, if I can add to that, if you don't
Okay,
mind.
one other aspect that yes, please go ahead.
Yeah, so in Mumbai, I can tell you for sure that the testing has come down for the right reasons. That labs have definitely increased the capacity, but fortunately, because of whatever lockdown has been imposed, I think the testing volumes over the last week have come down for the right reasons, not because the labs don't have the capacity or have stopped testing. In fact, all labs have increased capacity for testing, but people have followed the lockdown or the COVID appropriate actions, and I think that has definitely brought down the load because people are staying indoors. The infections actually have come down for the right reason. So I think in Mumbai, definitely the testing volumes have come down, fortunately, for the right reasons.
Okay, so and it's interesting that you raised that point because a lot of people have been saying this, that can we really take, say, for example, Mumbai's numbers and see it as a positive sign? Yes, the cases have come down, but so has the testing. And is that why we're seeing lower positive cases? But you're saying it's actually a sign because fewer people are feeling the need to get themselves tested or getting
Absolutely.
infected.
Absolutely. I mean, it's for the right reasons, and we are seeing a consistent drop. It's not that suddenly one day the numbers came down. In our lab, we've been going down by 1,000 samples every day, even though our testing capacity has gone up, like I mentioned earlier, to double. So if we get an increased demand, and like other labs also, all labs will be able to meet the demand. But actually, the numbers have come down, I believe, for the right reasons, that the infections in Mumbai actually have come down.
Okay, I had one more question, which is also more to do from a policy basis. But since you all are, you have the insights on what's going on within the testing setup, I wanted to ask this question. A lot of cities have this rule that you only get admitted if you have a COVID positive report. Now, Dr. Goyal, is that something we may need to relook at and make it a little bit more flexible, especially in cities where reports are getting delayed by 5 days or 7 days, even though the people are showing symptoms, they're not getting an admission in the hospital?
Tanvi, I think it's a very right question, and need of the hour is to find a solution to that. Because it's a paradox that you have symptoms, you want to get admitted, and you say, hey, I want an RT-PCR test. But listen, the RT-PCR test will take up to 24 hours. So what do? You expect the patient to lie outside the hospital on the bed? No ways. So I personally feel that in favor of the patient, there should be a clinical evaluation of the patient. Try to find out that what kind of symptoms he suffers. Basis that person should be given the priority for admission. While we are waiting for the test report, if you're so urgent, we can do a rapid antigen test on the spot, which can give you a report within 10, 15, 20 minutes, right? So even if it's positive, which is the chances are very high for a symptomatic patient, your thing is ruled out, right? If negative, you give a chance for the RT-PCR test, which will come within 24 hours anyways. So a patient with symptoms, for whatever reason, has the first right to get admitted in a hospital, whether it's COVID or non-COVID. And as he gets further evaluated, if it's COVID positive, the further protocol can be followed. So I feel the basic need of doing a test before admission should be, I think, at the moment with so much of demand, so much of crisis, one should be looking at it more favorably to admit first and then look at the test. A lot of people suffer just because they are not able to get the test done on time, and there's the logistic issues, and the reports are not able to come within 24 hours. So obviously there are challenges.
Tanvi,
Yes, absolutely.
Can I
So
add
maybe
to
that is
that?
something that the city authorities and hospitals must look at. Yes, absolutely. Go ahead, please.
Yeah, so the reason why I'm just trying to speculate on behalf of the hospitals is that they need to triage the patient. They need to be able to decide COVID versus non-COVID. As Vinay
Correct.
said, I think rapid antigen is definitely a solution at point of care. But there are also two other opportunities that hospitals can help with. One is, a CT scan is a good sort of non-direct indicator. A CT scan of the chest can also give you an indication, is it COVID or it's not COVID? That could be one option that hospitals can adopt. And there is also something called as, a rapid point of care test, which is equivalent to a PCR. Of course, it's a little more expensive than, the PCR test, but that is almost equivalent to a regular PCR test, which gives you the result within half an hour. So for example, some of us, like we have adopted that at the airport, so people can get the test done within half an hour, you can get the result. So maybe some hospitals, where there is a critically ill patient, antigen testing, CT scan screening, and POCT test. These three tests, these three opportunities are there to triage the patient and to take a decision, COVID or non-COVID, and then admit accordingly. So I'm sure hospitals are doing that as well.
Those are options as well. We do know many hospitals are now resorting to CT scan as well, but mostly though it is a few days after the COVID patient has tested positive. But perhaps we can look at some amount of flexibility to ensure that at least those who need urgent medical attention are given that and are not left out for the want of a test report or a positive test report. Thank you so much, Dr. Velumani, Dr. Goel, and Dr. Sanjay Arora for joining me on this conversation. This is a very important piece of our entire COVID chain and the entire COVID battle, testing. It cannot go down, it cannot even remain stagnant, especially in worst hit states and cities where we are seeing a high number of cases. The only way we can prepare ourselves better and track this better and contain this faster, the first step to that is higher testing. So whether it is Maharashtra or Gujarat or Madhya Pradesh, Karnataka, where again it's now becoming a problem, especially in the big cities, perhaps why they had to go into a 14-day lockdown as well. Uttar Pradesh today has seen a drop of 14% in testing versus the last few days. So not only were they stagnant in the last few days, today it's gone ahead and dropped. Delhi, the testing has dropped, and that seems to be the story everywhere else. It shouldn't be the case. Along with the experts in the testing labs, we need to come up with a more comprehensive policy to figure out how else do we identify the COVID positive patients and ensure those who need medical attention urgently are given that. Thank you so much for joining us.